So this is our demonstration over how our telehealth program works. I kind of just wanted to show the equipment, kind of do a run through step by step of what we do. So we have Meredith Abney with us. She is a third grader here at Pulaski County Elementary School. You want to wave to them? So this is Meredith. And so let's say Meredith comes to Nurse Mary, that's our nurse at the elementary school, and says, my ear hurts, really bad. So she'll call me, and I will call her mama, Miss Christy, and say, hey Christy, this is Morgan. I'm with Telehealth. Meredith is in here. She's complaining about an earache really bad. She says has her nose been running or anything? And Mom we can see a physician at school. Would you like her to see a physician in the nurse's office? So at that point, her mother can either say, no, I'm really not comfortable with that. I don't want her to see that. Or she'll say, yes, we'd love to see, we see Dr. Kopaz. So if we can see Dr. Kopaz today, let her see her. If not, we don't want to see, that's our primary doctor. That's who we prefer to see. Or she can say, we see Dr. Kopaz, but whoever you can get her in with, just let her see someone. Any of those options are completely up to the parent. It's always up to you before we do anything else. We have to have your permission before I even call to try to schedule an appointment. So her mom says, yes, I'd like her to see Dr. Kopaz. If you can, I'll ask some questions as far as, how long has your ear been hurting? And she might say, well, this is just the first time I'm hearing it, or it might have been going on for a week. Whatever that situation is, I'll get that history from you. Does she have a history of ear infections or earaches or sinus infections, anything like that? We'll just do a run through of whatever her symptoms are, get your permission, and then we'll relay all of this to the doctor. So once we have permission, she's enrolled, we call out, and she has a 10 o'clock appointment. But either nurse, they will take all of their vital signs from height and weight, their respiratory functions, pulse, blood pressure. They'll do all of that. We have one single form, but it's got, really everything. Family history, what are they allergic to, all of these different things. And once we have it completely filled out, we fax it to the doctor so that they're ready to go. We also have our stethoscope that I was speaking of. You can see it looks just like a regular stethoscope at the hospital. So I would come on and I'd go to our app that we have to use it. And, Meredith, I'm going to take your heart and lung sounds, okay? And just like that, we've recorded one of the heart sounds. And then you have on here, you just go, it's a drop-down menu. It's got all 4 of the main heart sounds and all the different lung sounds. So whatever the doctor wants, we can go through, you click each one, record each sound, and have those done. This is also something we do in that 30 minutes prior to have everything ready for the doctor. We want it to be as quick and as simple as possible so that we've got all vitals, heart and lungs, all of that is done. So now, and kind of depending on what it's for an earache like this isn't something that's contagious. If she comes in at 8 o'clock in the morning and her appointment's not until, say, noon, we'll go ahead and have all of this done and she can go back to class. So you're not missing, instead of like being in the actual office, where she's got to sit there in the waiting room, and if they're running behind, just all of that, she gets to go back to class now. And again, this is where it goes back to, if it's something we think is contagious or something emergency or needs to be handled right then, we wouldn't use that for a telemedicine. But for an earache, we can get all of her stuff, she can go back, get another class or 2 in, and just bring her back in for her appointment. So once we get to her appointment, I'll get out of our stethoscope. We have our fancy webcam here right now, just because we're doing a demonstration video. I have it just straight on her, but normally it sits right up at the top. It sees me and it sees her and anything our nurse does. So, she's in for an ear infection. A lot of times, the doctor might say, well, I need you to feel her lymph nodes along, her throat. And it's got, a fancy name to it. And that's when we'll get Nurse Mary. Anything truly medical, or whether it's palpating, that's when they feel it on your throat, it's called palpating. And if they want that done, or they want them to, we had an appointment that they wanted to check the pulses at different spots throughout from like head to toe. Our nurses will do that, and they'll be able to, we can, our camera picks up, it moves. If they want to actually see it done, or they can sit there and watch them to make sure they're feeling in the right places, and our nurses will do any of that. And then once they're ready, they really direct us. But this is our scope. As you can see, this side, see if I can get it. It turns on, and this side is a screen. This is where it shows the side that I can see. And then we have another app. When I swap it on here, we'll show it momentarily. But when you put it onto the camera, everything I see on my screen, so everything I'm looking at on Meredith here, is showing up on my screen and on the computer screen. And whatever's on my screen is also on the doctor's screen, so that they can see it too. And it just deemed that we have it connected. But this is one of our tips. As you can see, it looks just like what they put in your ears and nose at the doctor's office. I went ahead and pulled a tip out. We have the little tips for it. They get changed with every student. Even if, if we go to her ears, to her nose, we might even swap them there, just kind of depending on, the student. Especially if, sometimes you have some earwax in your ear, we don't want to put earwax in someone's nose. So we have plenty of these tips. We're very sterile. You just put our tip on. Come here, Mare. And say it's her right ear that's hurting. We can just go in, and I don't have it on my screen right now, but I can look into her eardrum. And I can see all in her ear. The doctor will be able to see it. She can look in those canals and say, oh, your ear's really red, it's swollen, and try to make a diagnosis through our telehealth. But this one can also go up in the nose. It can go in the ears. And this is one of our head tips. And then we also have, I mentioned just the general scope. And they're all just on the same one scope. It's all just one thing. And we rotate those out. So this one is it's just a circular, it's just general. This is what we look in throats with. As I mentioned earlier, there was some slight confusion. Some kids thought that we might actually put things in their throats. That is not the case. We do nothing invasive. We have our camera here. Can you open your mouth for me, Mare? And stick your tongue out and say, ah. We can look, we can see on the screen. We might have to use a tongue depressant. It goes on the very end just so we can look into that throat if the doctor needs to see it. Our general scope can also see, can I hold your hand, please? Say she's got a rash right here. She went out to recess and come in and they think she might be allergic to something. There's a rash. If that's what she's in here for, we can put it to where instead of just putting it up to the webcam, we can hold our scope to it and they can see, up close what this rash looks like if they're thinking, kind of what it is. So we have that scope as well, and it does not actually touch. We do still clean it after every time, just, to be on the safe side, but it never actually touches in the mouth, on the skin. We do nothing invasive in our clinic. So we have that one, and then our final tip that I talked about earlier is our dermatology scope. And now when it cuts on, this one is one that is very high-powered magnified, and can I hold your hand again, please? You're looking at something, whether they want to see it up close for, I don't know what reasons they would, it goes to the actual skin, and it lights up, and it is highly magnified. Like you can see, I can see her little freckle, and it's about this big on my screen. And even you can look into the hair with it, and when you put this into the hair, I'll try to see if it will pull up, you can see individual hairs. So I know no one likes to think about things like lice, but a lot of times that's a very just kind of inconvenient illness. Lice is not life-threatening. If they're coming in, if we can go ahead and get them some medication, you can get it and it won't be spread from child to child. But sometimes the doctor's they're gonna want to see, okay, they're not just their head doesn't just itch. They don't have dandruff or whatever other issues, a rash or whatever might be happening. So we can put this in. Sounds really gross, but you can see the little bugs moving around, and we can get them something prescribed to get rid of those so that we're not spreading it to other children. So we can go into the ear. There's some earwax there, but that's normal. You can look up in there and see a nice pretty eardrum. We can focus in. Let me see, focusing the wrong way. There we go. Look at that nice pretty eardrum. You can see all into the bone. There's no fluid. It's nice and shiny. That's a good eardrum right there. So we can look through at that. So then we swap to the general one. Say they had a rash, we can show it up close to the doctor and look down her arm. Or if they want to look in the eyes, can you look up and down your eyeball? I just move your eye. There you go. So if they need to look at any of that, open your mouth. Say ah. We can turn this light on. So you can see at the back of that throat. Say ah. Ah. And that's what we see. Like you can see that. Or if you look into the hair, you can literally see individual hairs. Maybe you hold it in. You can see individual hairs. So if, see, she's here nice and clean, but if we were looking for lice, like you would see the nits, you would see you could see them moving. So at the conclusion of an appointment, I would always call back with the parent, say anything that if the doctor prescribed any medicines, tell them that, tell them where they can get it. If they can, either we can have them sent to the pharmacy of your choice, or we can just have them write it and you pick it up at your convenience. But I would always call back and say every little thing, even if it was just, well, I think she's just got some earwax buildup. That's the only reason her ear's hurting. Anything the doctor says, no matter how minuscule, I'll always get back and tell you those things. And that would be the end of our appointment. Miss Meredith would go back to class, and any prescriptions she needs would either be called in or sent, and she is back in class. She's seen her doctor, she's gotten her diagnosis, and she is ready to get back to being 100%. So thank you, Meredith, for letting me use you as a demonstration, and thank y'all for letting me speak with you a little bit about our telehealth program. I hope it has been informative.
Hello there. My name is Randy Flowers. I'm the nurse manager of the intensive care at Taylor Regional Hospital in Hawkinsville, Georgia. I'm here to talk to you a little bit about our teleconference, a new service we're providing for our dialysis here at our hospital. First of all, we have a computer here, and basically it's a real simple setup. We have a simple laptop and also an iPad. And what we can do with this is call our physicians, and we are working with the Emory physicians in Atlanta. And we can give them a call and they can look at the patient and also do their assessment on the patient before we do the dialysis. One good thing about this system here is we have a Bluetooth capable stethoscope. And we set it up with a computer, and the physician in Atlanta or anywhere else they're at can listen to the heart sounds, the lungs, the dialysis cath, whatever they need to do. They can listen to the patient as I listen to them. Well, there's some software here that we can move around to kind of give the physician a clue on what he wants us to listen to. But he also, with the iPad, can take a look at the patient, talk to the patient, and do his view assessment on the patient. Other thing we have is we are providing dialysis for our local patients. And we have a dialysis machine that's been provided from Sanderling Renal System, and it's right over here. And I'm not an expert with this equipment, but it's real nice equipment, real simple to use. A lot of patients use these for home use. And we bring dialysis techs in for any patient that we have, and we take care of them. One thing important about teleconference and any services like this is we're able to assist and help our patients in our community. Instead of, before we had this service, we had to take the patients come in the emergency room, we would have to ship them to either to Macon or to Atlanta to receive dialysis. And these could be even simple surgery cases that we can do here that we have to ship out because they are dialysis patients. What this does is help the patients to where they don't have to travel long distance, help the family members because they're still in the local community, and also it greatly helps the local and rural hospitals to bring in better revenue sources and bring in better services. Not only dialysis, you can also use a neurologist. I worked one time in a place in Massachusetts that they were considered a stroke center, where they were able to provide more money in the community, at the community hospitals. But they use doctors in Boston, and they were able to treat the patients. And one thing about teleconference, you can see a specialist like that is time. For dialysis, for stroke patients, is time really important for these patients. And this basically just shortens the time of treatment, which is either brain cells or kidney cells or any type of cells like that. What this also does is we have a general surgeon, we have orthopedic surgeon here at the hospital that are able to do surgeries. But they're having to turn away patients to Macon in Atlanta because we're not able to give this dialysis treatments. Dialysis treatments are done about every other day, every third day. So if they're in the hospital for more than 2 days, they will need to receive their dialysis treatments. So what this does was we can bring the patients in, get their surgeries or whatever they need, and also put them on the floor or in our ICU and for them to receive their dialysis treatments instead of having to go to Macon, Atlanta, or anywhere. This greatly helps local community hospitals, which are already struggling, and it brings in better revenue and really assists our patients. And hospitals are very important to small communities. And if the hospital does close because of revenue sources that we're not able to do things, then it really affects our small communities, our welfare patients, and everything else. So just let you know that the teleconference can bring in better services and with specialized doctors and everything. Montezuma is a good example. Is the patients in Montezuma in that area, they have to drive 40, 45 minutes to Americas, to Warner Robins, to Macon. It's really affected the healthcare.
Occasionally they come here.
Occasionally come here. It's really affected the local communities with their healthcare. And then when the hospitals move out, then primary care doctors move out too. So it really has hurt that community a lot. Yeah, I know people who live in Montezuma that.
It's devastating.
And you're talking about a 45-minute drive to a hospital when you're having a heart attack.
Yeah.
An emergency
When
situation.
you're having a stroke, you're talking about cells being destroyed. It really affects, I mean, you cannot get that time back. And it does damage to heart, kidneys, and brains and everything in your brain. Hello there, Dr. Cox. We're actually filming right now. I just want to just use FaceTime just to give an example of how we can call different physicians. How you doing?
Yes, sir.
How you doing?
Good, doing good. You're good.
Very good. You see us?
Luckily, I can see you. Yeah.
Okay, great. So we're just filming a little bit here, and we have your face on FaceTime. Any comments about using teleconference and FaceTime for patients? Oh.
Well, a couple of things. First thing is, it is beneficial. When I first heard about it, before I was even really finishing medical school, I was a little skeptic because I was like, well, I can't put my hands on the patient, this and that. But then when I became a physician, I've seen what it's helped. Now, I don't think that, obviously, it's not going to take the place of all the specialists only having one in New York and come down to Florida through a teleconference, but it has made a difference for the smaller communities. So that's where I think this teleconference is good. I mean, I'm doing dialysis on a patient as we speak because of this teleconference here in Taylor. And the revenues for Hawkinsville, but also it's better for the patient. So it's really, I would say, even more useful for me in the smaller communities to use teleconference. That's my biggest thing.
Okay. Okay, sir. I appreciate it. Thank you for this time to come to you to kind of explain some of this information that I did. I think that with the day and age of healthcare and the day and age of smaller community hospitals, the teleconference does bring different services to our local and rural communities and to support the hospital and also our patients. This is very important for us to continue and have funding for. Thank you for your time, and I thank you. Bye-bye.